The most common body part to need surgery after a sports-related injury would be a significant knee injury where an athlete tears their anterior cruciate ligament, which is one of the main ligaments in the knee and a main stabilizer of the knee. Unfortunately, in those cases, that is a surgical procedure that needs to be performed where the ACL is reconstructed. Children commonly can bounce back from a surgical procedure a little bit faster than adults can, although it's important to know that it takes the same amount of time for ligaments and tendons to heal after a surgical procedure. It's just that once the child is ready to go and return back to their sport, they can bounce back a little bit faster than an adult can. In general, after a child or athlete has a surgical procedure, assuming that everything heals appropriately, that child and athlete should be able to return back to all activities without restrictions for the rest of their life without any significant long-term effects. The risks of any surgery, particularly children who have surgery or athletes who have surgery for a sports type of injury, include bleeding, infection, nerve damage, need for further surgery, revision surgery. All of those risks are very low. They're not common in a sports kind of surgical procedure, and overall combined it's about a 1% risk. I think the questions that parents really want to ask their doctor would be to get as much information as possible. You want to learn about the injury. You want to learn about the anatomy of the injury. You want to learn about what kind of treatment options are available, surgical versus non-surgical. And if surgery is decided, you want to learn about the procedure, the initial recovery in the first couple days and weeks after the surgery, as well as the long-term recovery, and then at what point your child or athlete can return back to their sports without restrictions. I also think it's important to ask about your doctor's experience doing these sports-specific surgical procedures and if they're fellowship trained in sports medicine. In general, after a child or athlete has a surgical procedure, they can return back to their sport without restrictions between 4 to 6 months after the procedure, depending on what was done. I do think it's important to understand that once your child is allowed to go back to sports at 4 to 6 months, it may take another 6 months to get back to playing that sport or activity at a high level. As much as I would have loved to see Derrick Rose play last year, I think that whether you're Derrick Rose as a professional athlete, a high school athlete, or a weekend warrior, you should never play any sport if you're having any kind of pain or you're not sure if you should play. If you're having pain or you don't trust your body part, you're at a high risk to re-injure that body part again. You're at a high risk to change your mechanics and injure another body part. So you really shouldn't play unless you're feeling 100%. So as much as I would have loved to see Derrick Rose play last year, I totally agree he shouldn't play unless he feels 100%.